as well, and hopefully we'll have a reasonably cooperative baby. So we'll start off by looking right around the outside of the uterus at everything but the baby. This is the placenta here forming along the back wall of the uterus, and we like to look at where the edge of the placenta is. I'm just going to pull that down a little bit further in relationship to the birth canal. So might do that with your bladder empty in a moment as well, so we'll have a look at that a bit later, because we like to make sure that the edge of the placenta is not near the birth canal. This is looking at the cord inserting here into the centre of the placenta, so that's lovely as well. So we'll start off by having a look at something baby does want to show us, which is the spine. So we can see the spine here looking directly from the side, coming all the way down to the bottom. So you see that lovely sort of shape of the spine as it comes all the way down. There, and the nice skin line at the back there covering the spine. And we can also see the spine in cross section coming all the way down to the bottom. This is the little bladder here with a little bit of fluid in it. They swallow all the fluid that's around them and it filters through the kidneys and into the bladder. So when we see fluid in the bladder, it means the kidneys must be functioning. You can see the blood flow here in the umbilical cord as it comes into the front of the tummy. It should divide and go either side of the bladder, which is exactly what it's doing there. You can also see fluid here in baby's stomach, which is good too. It means those kidneys are functioning and the swallowing is happening. Little kidneys here on each side of the spine, one kidney there and the other kidney here. And we also like to have a look at the spine directly from the back. As it comes down and tapers down in between the pelvic bones. So again, the lovely shape of the spine. The baby's wriggling everywhere, so as it comes and tapers all the way down to the bottom. All the way up to the head. It's a lovely looking spine. Okay, so this is baby's head here as well. There's a number of different structures that we like to look at and measure within the brain. The normal structures that we see, so we can also take a measurement of the diameter of the head and the circumference of the head too. They're two of the measurements that we do to look at the growth. These areas here at the back of the brain are the ventricles. They're another normal structure that we see too. You can see the nice midline of the brain coming down the middle here, the two halves of the brain symmetrically on each side, and the shape of the skull around the outside looks good too. This area here at the back of the brain is the cerebellum, another normal structure that we see, as well as these other areas here at the back of the brain. Come over this way and have a look from a different angle as well. Face in here too, just looking directly at us, so we can see the little eye sockets here and here and the little lens of the eye. And you can also see coming forward to the nose and the mouth, so the nose, the little nostrils, and that's the upper lip coming underneath the nose. So making sure that that looks nicely intact coming at the front. Lovely symmetry of both sides of the face.
She's got your nose, honey.
And you can also see the face from the top coming down as well, with the little eye sockets on the nose and then through the palate and the chin. And then we also like to look at the profile view of baby's face, which is not quite lying in the right spot for at the moment, so we'll come back to that in a minute. Just going to skip on to the heart now, because we can see the heart nicely from the side view, and in this major view of the heart here we can see the biggest vessel coming out of the middle of the heart, and it hooks around and goes down in front of the spine. So we like to look at the heart from two different views, and that's the side view there, so that lovely hooking around of that vessel. and the little head and neck vessels come off of that as well. So that's looking exactly as I expect to see it today too. The whole heart's about 1 centimetre across at the moment, it's about that big. Looks enormous on the screen, but and then we can see the different little chambers of the heart here as well. The ventricles and the atria, but we always get the best views of the heart when the spine here is down the bottom, so we'll just wait for baby to move around a little bit for that. Okay, so baby's tummy. Tummy is another measurement that we do to look at the growth as well. Arms now. This is an arm bone here from the shoulder to the elbow, and then from the elbow here coming down to the hand. So we just start to see the little knuckles here as baby gets in the right position. The little knuckles and the little thumbs just tucked in on the side. And then the other arm and hand is up by the head here from the shoulder to the elbow, and then the elbow coming up to the hand behind the head there, so you can see the little thumb. And then the other little fingers in this corner here. Thumb there, and the other 4 little fingers. Nice looking arms and hands. This is a thigh bone from the hip to the knee. And that's measuring everything that we need to with the baby, and everything's growing nicely in proportion. So that lovely symmetrical growth has occurred just within a few days of where it should be. So that's lovely growth. See the hip to the knee, and then the knees, the legs are tucked underneath baby's bottom here. So from the knee coming down to the foot, little toes here. Are you feeling all of this movement too? No, not really. Certainly moving around a lot, which is good. You can see the toes on the foot there, the big toe and the other little toe. So lovely right angle of the foot to the leg. So that foot, where did it go? This foot here belongs to this leg that's just kneeling down, so coming up to the hip. And the foot here, that's the other foot right next to it there. The knee here is a sort of kneeling down at the moment from the hip to the knee, and the knee coming up to the foot. So it's the other little toes here as well, the big toe and the other little toes, tips of the toes coming across there. So nice looking legs and feet too. And in between the legs here, it certainly does look like a little girl. Little labia here between the legs. So yeah, that's what it looks like to me too. Hands straightening out now, little fingers are moving around a bit more. We need to wait for baby to roll over. So what I might do is I might send you to the toilet so you can empty out your bladder, and then we can keep going. So far so good, and there's just a few more things that we need to see. Okay. So I'll show you where the toilet is. Looking good so far. So you've been given a due date of the 21st of October?
Yeah, that's
right.
Yeah. And the wedding anniversary is on the 22nd.
Okay. It's well timed. Oh, that's fine. Back up on the bed, might give baby time to move around as well. So did you have any questions so far about anything? Yep, so far so good. Just a few more things to see. Hopefully baby will just roll in the right spot for those now. No control over where they go, these little ones. They're either going to get in the right place or they're not. That's better. So you can see that baby's just sort of rolled over a little bit more so the spine's not uppermost now. So you can see the little heart here. You can see the different chambers of the heart there. You can see the two ventricles and the two atria, the little valves that are opening and closing on each side of the heart, the septum that comes down the middle of the heart, and now we can also see the little vessels here as they enter and leave the heart, and their orientation to one another looks to be good. There's a little vessel that comes out of the left side and the one from the right crosses over at right angles to that as well. So that's looking exactly as we expect to see it there today too, which is good. So we'll have a look at the blood flow going through the heart. So it helps us to have a look at where the blood's flowing on both sides of the heart and then through these little vessels as well. So that's looking good too. The red and the blue just indicates a different direction of flow, whether it's towards or away from me. So it just really helps us to colour coordinate the flow whichever way it goes. It's lovely. So hopefully maybe we would have rolled over so that we can see the profile of the face here as well. There we go, little face there, cute. So you can see the lovely little nasal bone here in the lips and the chin. So if baby stays in that position, we may get a reasonable 3D picture, hopefully. Little hands up by the face. Oops, a bit of movement going on there. Some little face in there. You do get a bit of distortion with the 3D, with the movement that happens, but you can make out those features a little bit. Just try and get one that's not quite so scary. And then they sometimes roll away from us like this baby's doing now, and then you don't get such a good 3D picture. Try this one. You sort of see the fingers here, the arm, and then you've kind of got the nose and the chin. So you see that little profile a bit better. And then the arms come up in front of the face as well. Okay, so I'll have a look at the placenta here as well. So this is looking at the cervix, which is nice and long and closed, and that's the edge of the placenta there. So that is well clear of the birth canal. It means we don't need to see that later in the pregnancy, because if it's clear now, it will be clear later. So that's good. So we've had a look through baby's head. I just need to see one other structure in the brain here. this little structure here in the midline of the brain joins the two halves of the brain together on each side, so that looks lovely too. So we've had a look through all of baby's head, we've looked through all of the face, we've seen the arms and the hands, the heart, stomach, diaphragm, kidneys, umbilical cord, gender, bladder, legs and feet. The amount of fluid around baby is fine. We've seen the spine, the placenta's in a good position, and the growth of the baby is lovely. So everything there is looking very reassuring today. So I haven't seen anything there that we want to follow up on later, or anything at all that we're concerned about, so that's lovely. So I'll get one more 3D picture here. Not too much movement. Sometimes I think these 2D pictures actually look much nicer myself. Not quite as good as the other one, that's okay, that's as good as we're going to get today, I think, but looking very reassuring. So no other questions about anything? It was all pretty clear to you? Yep. So we'll send all of those results on to your doctor. Just give you another sheet there to wipe off that jelly.
Yeah, I think I feel something, I'm not sure whether it's just
Yeah, it can be.
stomach.
Yeah, it can be a little bit early at this stage as well to feel anything. So baby's certainly moving around nicely.
Okay.
Some photos there for you. So I'll just give you that DVD as well. It just takes a minute to finalise.